Thank you, KL, for having me back again. I appreciate it. Right. I always like to start my talks by saying thank you, because my passion in life for the last 40 years is being able to work with patients and hopefully add quality to life. And at eXfuze, I joined and became part of this incredible company so that we would have an opportunity to change the health of the world. And because of you, we're making some of those strides forward. We've got a lot of work to do. The world is a sick place, and we've got an opportunity to make a great change in that, and eXfuze cannot do that and does not exist without you and your efforts. So I'm always thankful to be able to talk to the distributors, so thank you. The talk tonight is going to be brought about by a doctor that visited me in Texas where I live, and he traveled 7,500 miles to come spend some time with me, and he's from Taiwan. And the reason he came, he's got a PhD in phytochemistry from the University of London. Very brilliant man. And his wife is also a PhD in chemistry from the University of London, one of the most prestigious institutions in the world, especially in nutritional science. And because of the results of these products in people in his country, in Taiwan, he came, and his question was, he said, Dr. Joe, I have one question. Why does this product work so well in so many people? And we answered that question, but it took 3 days. Now tonight, I've got to answer that question in about 30 to 45 minutes. So I've tried to put that together in a presentation, not to be used as a marketing tool, but to give you confidence and belief that the eXfuze scientific team really kind of knows what we're doing. And so I want to try to help you understand the answer to the question of why our products work so well. So if I could, I'm going to jump right into it. Is that okay? Yeah. Okay. Well, let me see if I can get this up here. First of all, that is the question. Why are our products working so well? And I want to start back with the facts of why that is. First of all, our products now have been used 6 years in the marketplace. And 6 years ago, we put a scientific team together to develop a product for the direct sales industry based on science, technology, and the work that we had done as a collective team. And we have only worked with physicians, doctors, making products for their offices, treating the sickest of the sick patients. And so when we put these products together, we had a design in mind. And we weren't sure that it was going to be perfectly suited for the direct sales industry, because in the clinical setting, we have control of the patient. We know their diet habits. We know their lifestyle factors. We know their history. And so it was really a big challenge to put products together that were going to go around the world and go into all kinds of people. So we've been doing this now for 6 years, and millions of bottles of our product have been sold around the globe. The products have been used by most races of people. And now we're on multiple continents looking at the results of these products. The products have been used by the very young and the very old. They've been used by people that are extremely ill. Even people like the doctor that came to see me, the reason he came is because some people that had terminal illnesses no longer have those terminal illnesses. And there's no answers in medicine as to why that can happen. So they've been used in the very sick. And I had an opportunity in one of my careers. I spent 13 years in professional sports designing nutrition programs for the rehabilitation of injured athletes. So these products have been used now in over 200 professional athletes as part of their training program. And we're seeing great results. So whether a person is sick or they're extremely well, the products have been a real value to that group. When we look at a population of people that are in Malaysia and in Taiwan, in Japan, in North America, we're just about to launch our products in Mexico and then all of South America. This is what's called in science and medicine an epidemiological study. How does food impact health on a population of people? So one of the things that we've done is we were able to evaluate on a global basis how the eXfuze products are working. And that's called an epidemiological study when you look at that. So we've done that, and here's kind of the bottom line. Doctors in every culture, every country that our products have been in have seen and reported miracle cases. Things that shouldn't happen are happening. And so the question becomes, how could that possibly be? And we hope to give you some clues about that. Again, not for marketing purposes so much, but to give you the confidence and belief to use the product yourself and really become a product of the product. And so I always like to know, how many people here have used eXfuze products and have had a positive result? And when I look at that, that in itself is a miracle, because that's about at least 90% of the room. And I know you are all distributors, but that is an amazing thing, because most pharmaceutical drugs, when we look at their pharmacokinetics and we look at all the things about those drugs, rarely do they affect more than 60% of the population that they're used in. And it doesn't matter the drug, whether it's an antibiotic, an anti-inflammatory, or some other chemotherapeutic agent, they're only effective in a certain percentage of people. And our product, we're seeing across the board about an 85% success rate. Our products have not worked on everybody every time. And that's one of the things that our scientific team is scratching our heads about. Why can't it work every time for every person? Because that's our goal. That's what we want to achieve. And that may be not possible, but we're continuing to try to improve this product so that we can then go to 90%, 95%. And maybe by the grace of God, we would someday be at 100%, where people would have a strategy that would create wellness and a better planet. That's, again, part of the things that we want to do. So the results have been miraculous. Have there been miraculous things happening here in Malaysia? Yes. I've been in a lot of meetings, and I've seen the slides. It's been unbelievable. I've been visiting some of those miracle cases. So we know the product is working. And so tonight, again, I'm going to try to give you some clues as to why. The benefits fall in kind of two categories. The first is health and wellness. We are a health and wellness company. Our products are not designed to treat disease. We make no claims about our products treating, curing disease. Our products provide raw materials to the body, and the body knows what to do with those raw materials when they're correct. And as you'll see, there's some incredible properties that exist in these plant compounds that create these miracles. So health and wellness benefits, what are they? And this is what I've talked to my patients about for a long, long time. First of all, a health and wellness target is better sleep. And in America, I don't know how it is here in Malaysia, but people are stressed and they push very hard and they have poor diets and they're not exercising very well, and sleep is a huge problem. And the importance of sleep, we know when the body is sleeping and it's in REM sleep, that the body turns on its regeneration and repair mechanisms. Now, there's nothing in medicine that you can take to cause your body to repair and regenerate. But sleep creates that environment where that can happen. So when we see people say, you know, I take your product and I don't know if I feel any better, but boy, I'm sure sleeping better. We know that that person is going to gain the opportunity for their body to become better from a health and wellness standpoint. So sleep is a very, very critical issue. And again, that's one of the health and wellness markers that we see. Another thing that I saw in my practice for 30 years, I practiced in a medical arena where my next door neighbor was an oral surgeon, a psychologist, a dentist, a medical doctor. That we had a group of all different disciplines. And every one of those doctors, 90% of their patients complained of lack of energy or fatigue. So when we see people that express more energy, we know that we've worked at the core level of health and wellness. So energy and addressing fatigue is a very, very critical issue. And most of the people that you're going to talk to, if you ask them, well, how are you sleeping? How are your energy levels? They're going to, if they tell you the truth, they're going to tell you that they have a challenge in one of those two areas. So you can suggest our product because it's going to be a strong player in those arenas. The next one is the area of the brain itself. Focus, concentration, and memory. When the body's under stress, it's going to have changes in the chemistry of the brain. And one of the first things that we see is the inability to focus on the task at hand and to concentrate and then to remember and recall and retain memory. Those things begin to change, not in old people like me. We're seeing it in the U.S. In elementary school children. They're just not able to focus and concentrate like their parents and grandparents did. So again, from a health and wellness standpoint, you must have the ability to focus and concentrate and remember things. And our product is a very strong player in that area. Now, one of the things that I noticed in clinical practice, and we certainly began to see this with this product when it was introduced around the world, people start taking 7+, and they have a bad diet. A month or so later, patients would come to me and say, Dr. Joe, I don't know what you're doing to me, but I never liked salad before. And I'm starting to eat that rabbit food for the first time. And what's happening that we know, we're changing the brain chemistry, and these molecular structures satisfy the brain, and the brain knows what's going on. So it sends a signal for you to start eating better. And that is an amazing thing, because changing people's diet is almost impossible. But when we introduced these botanicals, people had an easier time making better dietary choices. And so that is a critical function, is getting that diet back to what should be a natural food diet. In America, it's a huge problem. In Malaysia, I've been all over this country, and the food is incredible. It's pretty much all natural. And that's not the way it is in the Western diet, where food is highly, highly processed. So we're seeing, even in America, people start taking one of our products, and we have all of our products available, not just 7 Plus Classic, that they tend to start cleaning up their diet. And that is a beautiful, beautiful thing from a health and wellness standpoint, because without dietary change, your health can only go so far. Without adequate water, your health can only go so far. So these become incredible tools for the health and wellness strategies that we all need. Now here's another area that we've seen reported just across the board. People start taking our products, and the patients that I've talked to and the distributors that I've talked to that said, you know, Dr. Joe, I don't know that that product is helping me that well. And when I hear that, I always want to ask some questions. Well, how often, you've been taking the product a year now, how often before you started taking the product did you get colds and flus? And they say, oh, well, you know, I get 3 or 4, 5 times a year. And then all of a sudden they'll say, but I didn't get one last year. So what we see is the ability of the immune system to be modulating the health, and colds and flus and allergies and sinus congestion problems have changed dramatically. In Japan, if any of you have seen our Japanese distributors, I've been in Japan, about 1/3 of the people wear a mask over their face because of the incredible allergy problems that the Japanese people have. And a lot of those people that used to wear those masks don't wear them anymore. And that is a pretty unbelievable thing. So we see resistance of the body changing, which means we've impacted the immune system in some way. It's not necessarily elevated, but it's been modulated so that the body can take care of some of those things that was challenging it before. And the list could go on and on and on from a health and wellness standpoint. But if that's all it did, that would be incredible. That would be an awesome tool and a tremendous business opportunity to have that to offer to people. And she may need some with an allergy going on here. So the next area is the area that's not health and wellness, where we see serious health challenges that have been improved. And as I've talked to a lot of people tonight, they talk to me about a friend or a loved one or a family member that's got some serious condition going on. Nobody ever tells me about, well, you know, I've got somebody that's got the flu a couple of times a year, and I want to be able to help them. It's always something like cancer or diabetes or heart disease or eczema, or they're on dialysis. All the things that we've just talked about, those are serious health challenges. And across the board, we've seen those things improve that are almost beyond understanding at the level of science. So some of those things are in the area of autoimmune dysfunction. And those are critical issues in America. And they're unfortunately being imported around the world now because of our Western diet and the popularity of the Western diet. I noticed when I out my room, I see Kentucky Fried Chicken right around the corner. And I'm going, wow, I'm in Malaysia, and now we're importing our garbage over here for the people to eat. And that's what's caused our country to have a tremendous health decline. And so autoimmune dysfunction is rampant in the U.S., and some of those conditions are rheumatoid arthritis, systemic lupus, multiple sclerosis. Some very serious illnesses are autoimmune in nature, and there's some great now scientific understanding of how these botanicals affect the function of the body attacking itself. So we've seen those things. And again, medicine has no answer for autoimmune problems. They've got some steroid compounds that help the symptoms, but nothing changes the disease at the level, at the core level. So we've seen that, and that's tremendous changes. Another area, around the world, we've got an epidemic of a disease called diabetes. And it starts with the change in the ability of the body to normally regulate blood sugar. And this product has been a tremendous tool in normalizing blood sugar. Matter of fact,